Guests in this segment are from West Virginia Birth to Three. Nicole Sergent, good morning to you.
Good morning.
Sandy Knorlein, hello again, Sandy.
Good morning.
You have to give me an update here because I understand you got some difficult news yesterday. It's not the end, but it certainly is a roadblock.
Yep. So we're happy to be back. Thanks for having us again.
Sure.
As some of your listeners may know, we've been advocating for a rate increase for our program. We haven't had one since 2003, and that has led to a decrease in practitioners throughout the state in all 55 counties, limiting the early intervention services that we can give in person to infants and toddlers with disabilities and developmental delays. And we've been ringing the bell and educating people on what we do for years now. This year, we have been so fortunate and so grateful to have support legislatively. There were bills introduced on the Senate and the House side. The Senate bill, which is 707, last Saturday passed the Senate unanimously with incredible support, and we're just blown away and so grateful for the support there. Right now, that bill is parked in House Finance. And we have been calling and writing, and so many birth to three families and just supporters of our program have been doing the same, asking them to place it on a finance agenda. We were told yesterday that the House Finance Chair, Delegate Chris, said he will not be running the bill. His wish is that birth to three be funded through a line item in the budget, which we would be fine with. The problem is that the House budget right now does not include the funds needed to cover those rate increases.
So he wants it as a line item in the budget for Health and Human Services?
We're under the Department of Health, and then there's a single item, from what I understand, for West Virginia Birth to Three under the Department of Health.
But in the Department of Health itself, what the finance chair, Vernon Chris, wants is that line item to be funded in the budget under Department of Health.
Yes.
And it's not currently.
It is funded, but it's not funded adequately to accommodate the proposed rate increases that are in the bill.
And you want a rate increase because for the last 22 years, you've been frozen on the 2003 wage level.
Correct. And as we've
I want to repeat that, by the way.
2 decades.
Just in case people are not understanding what I'm saying, and by people I mean even myself, you haven't had an increase in your pay since 2003.
Correct.
But there were 5% raises given to state workers while Governor Justice was the governor. How did you not get an increase during those 5% raises?
So we're independent contractors, meaning we receive no benefits, and we are not considered state employees. Somehow, over the past 2 decades, our rate has not been looked at. When it was set in 2003, it was set based on data from reimbursement rates from private insurance, and there were accounts made for the fact that we only bill for our face-to-face time with families. So our rates were based on the insurance reimbursement rate, but they were doubled because we drive between patients, we have to type notes, talk to doctors, do a bunch of other things that we don't bill for. At the time, those rates were competitive when you were looking at surrounding states or working at the hospital or a clinic or something like that. That's not true 22 years later. And also, because we're contractors, the things required to have to do our job, a car, gasoline, malpractice insurance, a license, continuing education, a computer, testing supplies, retirement, on and on and on, those things have obviously gone up substantially. And so, in effect, we've taken a pay cut. And what we've seen is a mass exodus of providers, not because they don't love this job. Everyone loves this job. I will go on record in saying it's the best job in the world, I think. But they can't afford it. I mean, it's hard to pay bills when you're paying things to do your job that cost more than they did in 2003, but you've not received a rate increase. So, I mean, this rate increase this session, it's desperate. I mean, it is essential, it is needed, and it is frustrating that we've gotten as far as we have just to be roadblocked. Now, the numbers are there in the governor's budget from what I understand, and the numbers are there in the Senate's budget from what I understand. And from who we've talked to and things we've seen on other news sources, They're continuing to negotiate and make plans. As you know, these budgets have to come together at some point this week. So we're hoping that somehow the funding is covered, but also, we would like the delegates who we've had overwhelming feedback from that they support our program and see the need from this raise. We'd like them to be able to vote on it on behalf of the people who are calling and supporting our program.
Matt Miller.
So, first of all, tell us a little more about the program itself. What is West Virginia Birth to 3 so that everyone can have an idea of what we're talking about?
So we're a federally mandated program. We do get some federal funding matches for what the state provides. We work with children under the age of 3, obviously, who we have specific criteria for eligibility. They're evaluated by a multidisciplinary team to determine if they meet those eligibility criteria. And then we write a plan on how we can help the families, help these kids grow and develop to the best of their potential up until the age of 3. And then we help facilitate that transition to other services beyond the age of 3 if they need it. So children can get services from an occupational therapist, a physical therapist, speech therapy, nursing, psychology, dietitian, developmental specialist, and then we provide service coordination on top of that to help link families up to resources across the state.
Across the state, do you have offices in all 55 counties? How does some of that travel have to work?
There are regional offices throughout the state for the administrative part, but we have over
700
somewhere
providers.
between 700 and 900 providers in all 55 counties.
Some of those providers work full-time. Some providers just see a couple kids a week and they have other full-time jobs. Nicole and I are blessed that we have done this job full-time for the last 20 years.
Without a raise?
More.
Without a
24,
raise.
Yeah.
Without a raise, 22
Geez,
years for me.
I think it's Sheets about 22 years ago. They were making about $6 an hour,
Yeah.
and I think they start about $18 an hour now.
We can't think of anybody else in West Virginia who hasn't had a raise.
I can't think of anybody anywhere who has not had a raise at
Correct.
some point. I mean, even if it was just a small cost of living raise. I mean, people on pensions get raises, Social Security gets raises.
Correct.
Everybody gets a raise.
And this is a highly specialized field. That's the other thing. I mean, there's such a demand for therapy jobs in particular. Yesterday, I got 3 text, emails, or calls asking me to go work somewhere else. 3, just yesterday. Sign-on bonuses, student loan reimbursement. I mean, people throw things at therapists to get them to come because there's a need for them. And so, to expect people to continue to do this job with no benefits and no pay increase, it's just not fair.
What would you prefer people to do at this time? Are you still recommending that they call into their delegates? Are you expecting them to call the finance chair, Vernon and Chris, directly? What?
Both. I think what we have encouraged, especially Birth to 3 families to do, is to share the story of their children, because the proof's in the pudding there. I mean, these kids have made incredible gains. Research proves that $1 invested in early intervention saves the state $16 down the road in the medical, educational, and criminal justice system. Sandy and I were just talking. I don't know if you want to share. She has a success story that she sort of gets to.
Yeah, go right ahead.
Well, I will talk in
HIPAA-friendly
terms. So in my other life, I run a lacrosse program, and just learning that some of my current high school players have been recipients of Birth to 3 back in the day when they were young.
Oh, cool.
So hearing the success of that and knowing I would never know. Never knew until this morning, actually, that 2 of my players were recipients, and that's a testament to the good work that we do.
And we
I
have
think
a
you're okay
colleague.
with the HIPAA rules, by the way.
We have
And I
a.
say that just on this. So when I go to like the urgent care or whatever, the lady at the front says, "What's wrong?" And she's behind a thing of glass, so you have to yell it out so everybody in the room gets to hear what's wrong with you. So I think they've relaxed those HIPAA rules.
Especially with minors, we take that very seriously. But we have a colleague who works for us, who's a developmental specialist, that was my patient when she was an infant. So the last time I had a raise, one of our developmental specialists was an infant in my hands, and now she works for our program.
Oh my goodness.
That's cool.
Well, let me ask you this.
And not cool.
Yeah.
That's horrible.
Is the way to go about this pressuring Chris or trying to get the delegates to put that line item in additional funding in the budget? Is that a way to get around what Vernon Chris is blocking?
You know, we're therapists, so we've had to kind of learn to be lobbyists this session.
You don't have a state representative that represents all 55 counties?
So we have a state office.
What are they doing today?
They are also, from what we understand, limited in what they can do as state employees because there's some laws that limit them from what is seen as lobbying. So if they are approached and asked for numbers or facts or figures, from our understanding, they can provide that, but they can't go knocking on doors and saying, I want to tell you about this. So that's what our colleagues in Charleston and Huntington, shout out to them. They have been doing that. They have been leaving candy bars and Easter bunnies and all kinds of things on people's desks and face-to-face time and talking. But, you know, from our perspective, everything is good. Telling stories, sharing a need, certainly approaching Delegate Chris's office. His secretary and I have become sort of friends, and she says that the calls they're receiving are overwhelming. They can't even answer the phone all day long. But I think talking to your own delegate and also approaching his office directly would be helpful.
Sandy, you said earlier this is a federally mandated program, and there are some federal dollars that come in. So the increase in the budget to provide for this rate increase, would it also be matched? Would there be additional federal monies coming in as well? So in other words, it's not just what the state can put in. There's even more money coming your way.
To my knowledge, and I'm a therapist, not a numbers girl. So our understanding is that there is some, and Nicole can probably speak to that actually a little better than I can.
A lot of our Medicaid programs, and again, this is general, I'm not a specifics number person either, but a lot of our Medicaid programs, if we as a state put forth the effort, the federal government matches that. And it's my understanding that West Virginia is one of the highest states to receive Medicaid dollars in that way. So yes, I mean, putting forth an effort on our part as a state means that we are receiving the federal support as well.
So your people at the state office, okay, the ones that you say can't lobby or do anything, they're state employees.
They are.
So they've been getting these consistent raises, whether they're cost of living or the 5%, 4 times?
5 times.
5 times.
Correct.
While you guys are getting nothing. This is ridiculous.
I will say that, you know, they have spoken out on our behalf. There's an ICC council that talks to the governor on behalf of the program in general and shares needs. We have heard from them that they have been in negotiations and sharing Birth to 3 stories and success and data with the governor for several years now and sharing comparison rates. So, I don't fully understand what they're allowed to do and what they aren't allowed to do, but they have been working in conjunction with us for several years.
Is there a workaround maybe where the governor could bring you guys in under the state program as state employees?
I think some states do it that way. My personal opinion is I do not want that to happen. We have so many providers that are they're speech therapists in the school system that serve a rural county after work. And I think in our state that would be very hard because I think it would be hard in some counties to get full-time employees in that way. They could certainly look at it. I think one of the draws of Birth to 3 is that people, especially people with young children, can work part-time or flex their schedule. You know, they can work on the weekends if they need to be off during the week. And so we've had great success with that model. We rank number 2 in outcomes federally for all early intervention programs. We're actually considered a model program and an example for other programs. And we're serving almost 14% of the infants and toddlers of that age range. So my thing is, it's not broken. It's working. Let it keep working, but just let us have something comparable to live on and to have a reason to keep staying.
You need to recruit. I mean, part of it is recruitment and retention. And without competitive rates, we would like to retire at some point in time, but we've got nobody in the
You
wings
guys
coming to
both
take
look like
in.
you're in your mid-20s.
I
You're
know.
way away
Thanks.
from retirement.
Well, we've said this, publicly many places. In Berkeley and Jefferson County, the providers that serve for physical therapy, I'm in my late 40s. We have a provider in her early 60s. There's no one younger than me. There's no.
Wow.
That's it. For all for full-time work in these two counties, that's it. And so we want to be mentoring younger therapists so that, because it's not something that you fully learn in school. Going into someone's living room, lots of different kinds of living rooms, gaining trust with families, engaging with them, understanding the nuances of doing that. It's a skill that has to be mentored and learned. We don't have anyone to mentor.
Are there currently families and children that you're not able to serve because of the financial situation, or is this a situation where if you don't get the rate increase, that will begin to happen?
I think we're doing triage. I think there's parts of the state that are there is some wait list getting through this, getting through the process. Out here in the Panhandle, we're doing triage. So we are looking at families. They might need 3 services. We only have 2 that we can offer. We might only have 1 we can offer in person. We might have some we have to offer virtually. I'm an occupational therapist. I'm doing part of Nicole's job for families because we don't have enough Nicoles. So I take them as far as I can, and then I'm like, okay, now I'm desperate. I need my PT in here. So we're taking developmental specialists who are doing some speech therapy kinds of jobs until we get to the point that we have a speech therapist available. So we're kind of triaging with our families, trying to meet their needs as best we can meet our needs with our low numbers of practitioners.
Yeah, I had a child a couple weeks ago who is deaf, and we did not have an in-person speech therapist available. So they were able to offer her a virtual speech therapist, but it's very hard.
Yes.
That's very hard. So yes, there is, children and families are suffering from services that we think they have a right to federally and deserve because this has happened. We've had, I can't even tell you how many colleagues, therapists with 20-some years experience, exceptional professionals that have left in the past 24 months. We keep having goodbye parties, and we're like,
When was the last time you brought on a new person?
There's no one younger than me in physical therapy. So I started working this job in 2001.
You haven't brought on anybody? You haven't been able to hire somebody since 2001?
We had another physical therapist consistently for a few years, and she works in Loudoun County now.
So if we were to do an interview with all people that move around and work the 55 counties, would they all have a similar story, or is yours even worse because you're in a high cost of living in the state?
I think that there are areas that probably are more in need. Like and this is just going off what I think. I don't know for sure. Mm-hmm. I think Morgantown area is better served because of the university. And I think certain areas, I know like Huntington, the same. I think they have plenty of, like, for example, developmental specialists from what I understand. But there are certain areas, especially the same can be said for the rural areas. Years ago, I was seeing a child virtually with clubfoot in one of the southern counties. And what was available to them was an occupational therapist that came to their county every other week from another county. So that was all they could get. There was no physical therapist. And you have to think, some of these counties, there's not even an outpatient clinic there. It's, there's not. And locally, our outpatient clinics have wait lists for pediatrics. So if you're a parent and you're in the NICU, and some of them have been there 6, 9, 12 months with high-risk babies or children that have had multiple surgeries, and the providers there are saying to you, early intervention is the golden ticket that's going to help you, support your child in the next phase, and you come home and you make that referral, and there's not a specialty, or you can have a virtual person but not an in-person person, and this is what you've been holding on to for the next step. That parent doesn't care whether the funding comes from a line item or a bill. They care that there's someone who can come in their living room and teach them what to do with their baby. And that's kind of the bell we've been ringing.
Whether it's just correct me if I'm wrong. Math is one of my favorite things. But whether it's a line item or it's from a bill, the money comes from the state budget, right?
Right, but the House line item doesn't have adequate money.
No. But what I'm saying is, either way, however they do it, the money is coming from the same pot.
Correct.
They just need to do this.
Well,
this
and
is
Mike
ridiculous.
and Delegate Hornby said he's been a big supporter. Senator Baird has been a big supporter of this bill, but Mike said people are going to keep leaving, and because we're federally mandated to provide this service, then we're going to have to increase the rate. But by then, the people with 20 years experience are going to be gone. So then we're going to get a lower quality product because we've let them go.
Not only that, you're going to be trying to hire people. I think the bump was 25% that I saw discussed this year. That's 1% a year.
Right.
So even then, you're still going to be behind those salary tables for those who are coming out of school.
And the 25%, honestly, is still a little behind where it should be.
Well, sure it is.
But it's something.
It's better than nothing, but
right.
it's 25% over 22 years.
Correct.
Ridiculous.
That's a one.
We got to take care of children. I mean, I don't know. I'm a West Virginian. We pay taxes. We all pay taxes, and taking care of children is one of the basic things that our government needs to do.
This isn't controversial. I mean, citizens and elected officials have been in support of this.
Oh, without a doubt.
We got to get going. Thanks so much for coming in, and you got hopefully the rest of this week to get this fixed.
Fingers crossed. Thank you.
Thanks so much.
We're back with more after these.